Hello, I'm Jaypriya and I'm here to talk about tuberculosis. So let's start the presentation. Okay, I'm here to talk about and teach about tuberculosis. So first, these are the topics that are covered that I'm going to cover. What is tuberculosis? How TB spreads, latent TB infection and TB disease, risk factors involving tuberculosis, how to test if you're having tuberculosis, treatment for tuberculosis, and elimination of tuberculosis. So first of all, what is tuberculosis? Tuberculosis is actually a communicable disease that which means it is spread from one person to another through the air. Tuberculosis is a disease that is caused by Mycobacterium tuberculosis. It is a bacterial disease. This tuberculosis is a bacterial disease which usually attacks the lungs. It can also affect other parts of the body like kidney, spine, or brain, but it mostly affects our lungs. So tuberculosis can be pulmonary tuberculosis, which is TB in the lungs, or extrapulmonary, that is TB in other places of the body like kidney, spine, or brain. So I have to inform that not everyone affected with TB germs will become sick. In some cases, they'll be asymptomatic and will not become sick. They'll not show any symptoms also. This tuberculosis is actually a very fatal disease. It is actually the second leading cause of the death in our world, and it is also the most death-causing infecting disease. Okay, so TB is actually not a disease of the past. We are still having tuberculosis, and too many people in US still suffer from tuberculosis. As you can see, for example, in 2019, 9,000 cases of TB cases were found in US, which is actually the lowest. In my country, I'm actually from India. In India, is actually the fourth leading country for tuberculosis in the world. So yeah, it is TB is still a case of concern. TB is still is actually very contagious, and still many people in India are suffering from TB. TB is a serious disease that can cause a person to become very sick if not treated with medicine. So if you're found to be with TB, you have to start taking treatment, or you'll become very sick. Actually, many treatments are also available to prevent and cure TB. So it is not fatal. If you take proper treatment and follow the medications, you can actually cure TB. Okay, now we are going to see about India, progress toward TB elimination in India. India, as I said, India carries about 1/4 of the global burden of tuberculosis. Actually, Indian government has made several plans for the elimination of tuberculosis. In 2000 meeting, a plan was formed to eliminate tuberculosis by 2025. Which outlines its approach, and it has been working so far. As you can see in this image, actually it is shown that in the blue line is representing the TB cases in 2019, and the red line is 2020. And you can see the decline in tuberculosis cases as from the past year to now. So you can see all the plans that government has made so far has been working very well in India. So now, how TB spreads. TB is a communicable disease which spreads through air. TB spreads from one person to another person when someone with contagious TB, that is, when someone who's infected with TB disease coughs, speaks, or sings. When they do, the molecules, the tuberculosis germs from the lungs is passed to another person. There are so many misconceptions about how TB spreads. It is not spread by sharing toothbrushes, saliva from kissing, shaking someone's hand, touching bed. No, these are false. These are misconceptions and myths. It is only spread when the germ particles come from the lungs, like when coughing. Only in those cases, tuberculosis spreads from one to another. So there are two types of TB diseases. One is latent TB infection, and the other is TB disease. So first, let's learn about latent TB infection. It is called as LTBA. For people with latent TB infection, they do not feel sick. Actually, this is the beginning stage of TB infection. They do not feel sick. They don't have any symptoms. And even if they are infected with TB, they do not spread the germs to others. If any person can have latent TB infection for many years and still show no symptoms. They have a small. This is because they only have a small amount of germs in their body. These are alive but are inactive. Only when they're active, if the germs become active, this latent TB infection turns to the TB disease, which is the second TB-related condition. This TB disease occurs when the TB germs that we have during latent TB infection multiplies and becomes active. When the TB germs are inactive, it is called as latent TB infection, and when they become active, it is called as TB disease. This TB disease is actually can be spread. This is the communicable one. These can spread germs from one to another. Yeah, so see here, this latent TB infection has a small amount of TB germs, has a large amount of TB germs that are active. This one is inactive, but that one is active. If you are infected with latent TB infection, you cannot spread germs from one to another. But if you're infected with TB, you can spread the germs from one to another. You actually do not feel sick when you're infected with latent TB infections, but you feel sick when you're infected with TB disease. Actually, in both the cases, even with the latent TB infection and TB disease, if you take a test, TB skin test or TB blood test, you'll be shown positive. In both cases, you'll be shown positive. So if you're infected with latent TB infection, you can start taking treatment to prevent it from becoming into TB disease. A person with TB disease requires a separate treatment for TB disease. Okay. Now, yeah, as I said, untreated latent TB infection can lead into TB disease. TB disease occurs when if our immune system can't stop TB. During latent TB infection, we have the TB germs in our body. If our immune system can't stop these TB germs from growing, they become active. This is called as TB disease. So most people diagnosed with TB disease latent TB disease will turn into TB disease in the future after several years of without any symptoms. So if you take an example for US, it is estimated that about 13 million people have been suffering from latent TB infection. If you have latent TB infection, it is very easy to cure it from progressing into TB infection. TB infection is quite hard to cure and requires very long term of medication. But if you have latent TB infection, treatment is 90% effective in preventing the development of TB disease. So if you are found to be having latent TB infection, please make sure to take the medications on time and take it continuously. Do not stop taking the medications without further checking whether you have stopped having the disease. Yeah, the same thing as we have saw. People with latent TB infection do not feel sick. They do not have symptoms. If the TB germs become active, this latent TB infection turns into TB disease. Millions of people in US have latent TB infection. Okay, these are the symptoms for tuberculosis. Night sweats. When you're sleeping in the night, you'll start sweating and fever, chills, weakness or fatigue, weight loss. You won't have any appetite. You won't feel like eating. And the cough is actually main thing. If you have a prolonged period of coughing, like cough lasting longer than 3 weeks, you should probably have to go to the hospital and take a test for whether you have TB or not. And pain in the chest, because it is tuberculosis affects the lungs, so you have to know if you have a pain in the chest. You have to go and take a X-ray to check whether you have tuberculosis. And coughing up blood or sputum, it is actually very important. This is a common symptom. Coughing up blood and sputum will maximum be related to this tuberculosis. People with TB are sick and can spread TB germs. Yeah, as I said, this is a communicable disease. So if you're found to have TB disease, so you'll be spreading germs. It is a very serious condition and it can lead to death if not treated. It can be treated if you start taking medication. It is not that fatal. But if you do not take medications, it will lead to death if not treated. TB disease, but if you take proper treatment, it will always be treated, and most probably you'll be cured with medicine. Okay, if you're showing symptoms for TB, you'll actually be having to take all these things: X-ray for checking lungs and for knowing whether there is any damage done to the lungs because of the tuberculosis. A prolonged period of medication, like 180 days of medication. You have to take lab tests to determine whether you have tuberculosis or not, and follow up and testing of close contacts, because it is a communicable disease. You may have, or without your knowledge, you may have spread to your relatives and your workers. So you have to contact your relatives and workers to take a tuberculosis test too, for making sure that they are well. So a TB person is exposed to someone at the TB disease. Contacts can include family members, roommates, housemates, close friends. People with TB disease can spread TB germs to those around them. So a local health department will actually conduct an investigation to follow up those relatives and to check whether they have TB or not. Government, I'm from India, so my government takes these measures. Our local department health body will come to our house and check and ask us to take test in case of TB. Okay, so risk factors. Actually, anyone can get TB, from children to old age. Anyone can get TB. So those people who have a higher risk of getting infected with TB are those who have contact with someone who has an infectious TB disease. Like if I have someone in my home who has TB, I have a high chance of getting TB as it is a communicable disease. So, and people who travel to countries with high amount of higher rates of TB. India is actually one of the highest rate of country, as I said. And Philippines, you can see Philippines is actually the third country with the number of people who are infected with tuberculosis. And healthcare workers have a high risk, are at high risk for TB transmission. Yeah, you can see here other countries. Mexico is actually the largest, 19%, Philippines 12%, India 9%. So yeah, but each country's government has trying the best to reduce the number of people and to eliminate TB. This is based on ethnicity, and as you can see, Asians have a high chance of getting tuberculosis. Okay, these are the people who are at high risk for developing TB. Those who have weakened immune system, like if you have HIV infection, substance abuse, organ transplant, kidney disease, neck cancer, diabetes. In all these cases, your immune system is actually weakened. So our body can't actually stop the TB cells to become inactive, to become inactive. So during these cases, our immune system is weakened, so we are easily prone to TB disease. These people are high risk people and have to check whether they are having tuberculosis or not. So TB testing. There are actually two types of testing which can be done to know whether you have a TB infection. One is TB blood test, and the other is the TB skin test. This TB skin test is also called as Mantox test. So if either is positive, you are confirmed that you have a TB disease. So you are further asked to take medical examination and chest X-rays to see if whether if your lungs is damaged or not. In TB blood test, a blood is taken and given to the lab for analysis. If you are infected, if it shows positive, you are mostly infected and you're infected with the TB germs. If you're negative, you are not infected with TB test. This TB test is also known as interferon gamma release assay, IGRA. This TB skin test is also called as Mantox test, and it actually requires two tests. For first test, one test is placed, and in the second visit, the test is read. Actually, there's a vaccine available for tuberculosis, which is called as BCG vaccine, Basil calmate guerin. I have been actually vaccinated with BCG when I was a child. It is actually a vaccine for TB disease, and it is often given to infants and small children in countries where TB is more often. I'm from India, so it is a fourth, as I said, it is a fourth largest country in which people are suffering from tuberculosis. So our country gives vaccination to children for tuberculosis. It prevents this vaccine protects against severe forms of TB in children. This TB vaccine is actually not widely used in the United States, as there are not many people who are infected with TB in the US. If you have taken the BCG vaccine, the skin test is hard to interpret. It won't show positive for sure, even if you are infected. So if you have taken the BCG test, you have to take a blood test. You have to take the TB blood test to make sure the results are correct. TB blood tests give more accurate results in people who have been received with the TB vaccine. So for now, we'll learn about the treatment. Treatment for latent infection can prevent the development of the prevent the development of the latent infection into the TB disease. TB germs in the body of someone with latent TB infection are inactive, so they will not feel sick. So people with latent TB infection should take medicine to prevent the development of TB diseases. Even if they're not feeling sick, they have to take medicine. So the treatment for latent TB infection, compared to the treatment of TB disease, latent TB infection is actually, the treatment plan is very simple. The duration is very small, very shorter, and the cost is very less, and it has fewer side effects. Actually, the government provides many plans for people affected with tuberculosis in my country, and they can afford the medicine too. Actually, if you are infected with TB disease, you have to start taking treatment, because it not only affects you but also your loved ones, your family, your friends, your co-workers, everyone. They can be infected, and they can be infected, so you have to start taking the medications to protect them. TB elimination. TB elimination is actually by it is actually healthcare providers have more they have to do spread awareness and make sure everyone those who have symptoms take their test, and they have to look out for those who are at risk for TB. They have to recognize the signs and symptoms, and they have to, if they show signs and symptoms, they have to they take the patients to take the test and treat the patients for cure, and those for they have to be aware of all the latest medications and shortest treatment for tuberculosis. And you should also be very open and encourage conversations about TB to make to desensitize everyone and to reduce the stigma of people who are thinking who are to to reduce the stigma and make people to go on and take treatment, so they'll feel well. So that's the end of my presentation. So spread awareness about tuberculosis to everyone, and if you see someone with any signs or symptoms regarding tuberculosis, make sure you you ask them to go and get tested and make sure they're healthy. Yeah, that's it for my presentation. Thank you.